right. Good morning. My name is Duncan Harris. I'm the owner of Insurance Savings Group and the president of Bakersfield Business Partners. Welcome back to our weekly podcast. And Bakersfield Business Partners is a local networking group here in Bakersfield, California. And we're a group of professionals and business owners. We meet once a week. And we're trying to grow our businesses through referrals, but also through education and through relationship. And so we started a podcast. We want to highlight our outstanding members. We're a group of about 25 people. So today we've got Jeff Haynes with us. Jeff, introduce yourself really quick.
Good morning. My name is Jeff Haynes. I'm a chiropractor here in Bakersfield, born and raised in Bakersfield.
Awesome. Love it. Well, thanks for being here, and we appreciate this. This is kind of a friendly interview to get to know Jeff. He's going to share with us maybe just some tips and pointers about chiropractic. He's going to tell us a little bit about his story and how he got started. So why don't you elaborate a little bit? You said you're born and raised in Bakersfield, and I assume you've been a chiropractor for a long time, but tell me how you got started in the business.
Okay, so playing sports when I was younger, I had injuries to my knees, had surgery on them from football, and going through the rehab from that, they actually started driving me towards wanting to be a physical therapist. And that was kind of my focus, or as I wanted to kind of move that direction, as I was going through school. When I got down to Cal State Northridge, I met a kid in school, and they needed somebody to help them at a chiropractic practice. So at that practice, started working there and actually kind of saw the inner workings of a chiropractic office and what chiropractic actually does. And that kind of shifted me that direction. And, I went to chiropractic school through there, and then eventually moved back to Bakersfield and started my own practice.
And the rest was history.
Pretty much.
So you've been working in chiropractic for a pretty long time. So what, when did you first get started? What year was that? Do you remember?
Yeah, so I graduated in August of 91.
Okay.
And by the time I finished up boards and everything, got licensed, it was about a year later. So June of 92, got licensed and started working up in Bakersfield. My wife and us were living down south. We have 2 kids, and I commuted for about 8 months back and forth from Valencia to here.
Oh, wow.
And then eventually we bought a house and moved back up to Bakersfield. So it was, that commute was tough.
Yeah.
It was
now
tough.
you were married and had 2 kids at the time. Is that right? Or
Correct.
A couple kids, or?
Yeah. When I graduated, actually I had by the time I moved up to Bakersfield and started working up here, we just had our second little girl. Actually my oldest is a boy, and our second was a little girl. But so when I was commuting up here, we had a 1.5-year-old and a newborn. So it was tough. My wife.
I'm sure your wife was really happy with you,
and she was working too. That's a tough thing about the cost of living and being in LA. It's definitely a 2-income place. So that was one of the driving forces to bring us back to Bakersfield, to where we could come back up here, have affordable housing, and she could stay home with the kids.
So that was what, 92? So we're talking about 30 years. This was 30 years ago.
Exactly.
So you've got a little bit of experience under your belt.
Yeah, just a little bit.
That's pretty good. So tell me about your business. Maybe like from an outsider or someone who doesn't know, maybe they think all you do is just like pop people's backs, to put it crudely. But there's obviously more to that than what you're doing. So can you kind of elaborate on everything that you're doing, everything that goes into, your business?
Yeah. So, and that's the thing. It's just, we don't just treat back injuries. We treat extremity injuries, shoulders, elbows, wrists, hips, knees, ankles. We pretty much treat the whole body. When we try to do it in a holistic way without drugs. Somebody has an issue far as, whether it's their neck, back, extremity, whatever, and they injure it and they have pain, the normal protocol for that in the medical world is you see your doctor, they evaluate it, they give you an anti-inflammatory, they give you some medication to help reduce the symptoms, hoping that it goes away. If it goes away, then you're healed, based on that based on that concept. Obviously, if it doesn't get better, then they take it a step further and want to do some type of therapy, which would be physical therapy on the medical side. And then if that doesn't get any better, they're going to move to diagnostic testing and orthopedic surgery, things like that.
Ultimately surgery, it seems like, yeah.
Whereas we want to try.
I get the sense you kind of are resentful of that approach.
No, not at all. I mean, that's just the world that we're in. In the way we address that, we do the examination, we take X-rays. As far as like the neck or back, if there are areas of the spine that get fixated or get locked up that are pinching the nerve, creating issues, you can take a drug and mask it. Or what we're going to do is we're going to try to find that issue and try to manipulate that area, restore the mobility back in there, get the pressure off that nerve, and let the body return back to a normal homeostasis and heal itself. And you're feeling better, you're moving on, versus just taking that medication. Because the problem is if you take the medication and you finally get to the point where your body forgets that pain, it really hasn't resolved the issue. It
hasn't fixed the core issue,
and it can come back again. So,
but look, let's talk about this, because you and I have had this conversation before. I think we're both kind of passionate about it. I mean, I do health insurance, so I see I hear about their back problems, their pains, their surgeries that they're going through. So let's be honest. Some people need back surgery.
Oh, yeah, absolutely.
But a lot of people don't need back surgery, and they end up getting it for one reason or another. And then you and I see the bad outcomes of that. Right. And so I think maybe that's why I could just sense like some emotion behind your response. I mean,
well, and if you think about it too, you look at when people have pain and they're given a medication, they're looking for that quick fix. Mm-hmm. Mm-hmm. And the same thing when they have back pain, like you said, chiropractic is not going to fix everything, but you always want to try those lower levels of treatments, before you push yourself to that point to where you think surgery. Surgery should not be an option. It should be a last resort. Obviously, if you have neurological conditions, that warrant more emergent type situations of surgery, you have to address that. I mean,
sure.
If you got loss of reflexes or, complete numbness, I mean, muscle strength, those are things that need to be addressed. But for the most part, there's a lot of things that can be treated, before that point too.
Sure, with less invasive treatment, right?
Exactly.
So tell me, I mean, you said you treat extremities. Like, how would you treat a wrist injury, right? Help me understand, like, how someone could go to the chiropractor if their shoulder hurts or if their wrist is, injured in some way. Like, kind of explain that to me. Educate me on that.
Okay, so, I mean, obviously, we're going to do an examination up front. We're going to do x-rays so we can make sure there's nothing underlying that we're missing.
Yeah. You have an x-ray machine in your office,
and we
right?
do. We do that on site. If we do find something as far as a fracture or something like that, then we have, we try to get them situated with an ortho that same day and get that addressed. But, most of the time there's not. So after we do our examination, we do therapies in office too. So we do electrical muscle stim, hot packs, low-level laser, ultrasound. We have a wide variety of modalities that we can use to help the healing process, along with the chiropractic treatment as well.
Wow, very cool. So tell me, what's an ideal customer for you, right? Like who's kind of the perfect candidate to come to your office?
We see a wide variety of patients. I see auto accidents. I do work injuries. I do a lot of sports injuries. Mm-hmm. As just kids, elderly. So, I mean, I see pretty much the whole gamut.
Just regular people,
just trying to get, and whether it's, neck, back, I mean, and that's another thing too is some people are like, oh, well, I had surgery. I can't see a chiropractor. Absolutely, you can see a chiropractor. There's a lot of things we can do even with people that have had prior neck or back surgery. So obviously we need to, know what's been done and we work around those issues. But I mean, definitely we can still have some good positive outcome from treating some of those areas that have had previous surgery as well.
So you're seeing all these people, and I mean, I guess, you're not the only chiropractor in town. Like, tell me, like, what do you think kind of sets you apart or makes you different from other chiropractors?
I always used to be the new kid on the block, but obviously I'm not that new kid anymore. But I think, time and experience, I've been involved in a lot of high school sports, worked with BC in the past, Cal State, seeing some of their athletes.
You work with some of the other sports teams here too, right?
Yeah, I'm also the team chiropractor for the Bakersfield Condors. I've been with them for over 20 years.
That's pretty cool.
Yeah, so it's good to be, part of a team and, trying to give them all those avenues of treatment that they need to keep them performing at their peak. So I think that's important.
Yeah.
Same thing, I think, with, like I said, we do auto accidents and work comp. I try to, I try to help everybody across the board, and I think taking a good approach. I'm not a pushy person. Some people, kind of worry about, oh, once you see a chiropractor, that means you have to go see him for the rest of your life. But
right, they're going to get suckered into some deal they're not comfortable with, right?
Right.
That's what they're always feeling.
But I think the biggest thing with chiropractic is if you can come in, you can get periodic treatment, and it's keeping you feeling good, keeping you moving well, keeping you working, keeping your lifestyle where it wants to be, and not having to take medication, then I think that's worthwhile. I mean, would you want to have to take medication on a daily basis for pain, or come and see a chiropractor 1 to 4 times a month? I mean, depending on, where their level of need is. I mean, it's obviously when somebody first comes in, the intensity of treatment's going to be a little bit higher because we're trying to get them to a stationary position to where their pain's not going to come back.
I had a lady I was talking to yesterday, and her monthly prescription bill was $160. And a lot of that was for pain meds,
Oh.
And I think, and I work with seniors and Medicare and stuff, and I see that a lot. The prescription list is 10 prescriptions they take. It's like it would be cheaper to go to a chiropractor, once a month or twice a month.
Well, exactly.
And then they wouldn't have all the, because the real downside is once you start taking a drug, there's like side effects to it, and then it changes your body and it starts giving you other issues.
Well, and if you see a lot of the commercials, you're seeing a drug coming out to help with the side effects of a drug that you're currently taking. So, you keep adding another drug because of a drug. So,
and I also do a little life insurance, and I recently learned that the issue these underwriters have is the long-term drug usage. It's not that they have this condition. It's that they've been taking the drug for so long, and that when you take a drug for that long, it actually starts to do bad things to your body, right? It's not the condition that caused you to take the drug, it's the drug itself. And that was something I had wrong in my head. Anyhow, I'm with you. I'm not a huge drug advocate.
Well, and I mean, and if you need the medication, you need the medication. I mean, obviously, but the thing about it is, and we've talked about this too, is trying to be up front, trying to eat healthy, trying to move and exercise.
Yep.
I mean, all those things are important in a productive lifestyle. I mean, if you want to keep moving, you can't be a couch potato and eat terrible and not think that you're not going to have high blood pressure. If you're eating a lot of sugary foods, that's definitely going to lead you towards diabetes. So I mean, there's healthy ways to try to change how we do things, but people have to make that change.
Yep. So you've touched on a few things that I want to dive into. You said you do like work comp accidents, auto accidents. So maybe give me or give someone who's listening some advice. Like, let's say they've been in a work comp accident or they've been in an auto accident. Like, what are some pitfalls you see those people falling into, or some different pointers that you
yeah, and I would say probably like with auto accidents, a lot of people are like in denial. I think they have injuries, and it's like, oh, let's just wait and see if this goes away. I'll be okay, and they wait and it doesn't get better. If they don't really have good medical insurance that's going to cover it, technically, if they were hit by somebody, that other person is at fault, and they have to, they're going to have to pay for medical bills, but insurance companies won't settle on all those past medical bills and everything until everything is complete. So for people to put money out of pocket to do things, sometimes it's kind of tough. So they'll wait, and by the time they get in to see somebody, it's maybe a month later. And then they have all these things, but then...
Why is that a problem?
Well, because the insurance company looks at it as, well, why did you wait a month to go
So they're suspicious of that.
Yeah.
They think if you were in pain, you would have gone the second day, third day.
Regardless of whether you have money or not, to cover those things.
Right.
So, and that's kind of and then I think that's the tough thing right there. A lot of people think once they start coming, oh, I'll just come a couple times and I'll be good. And, with those whiplash injuries, those things can take up to, 4 weeks to 16 weeks or more, just depending on the level of injury.
Sure.
I have had so many different patients where it's like, oh, I'm good, I don't want to come back. And I'm like, no, don't just stop, because what'll happen too is they say, oh, I think I feel okay. And then they stop, and then 2 weeks later they come back like, oh, I'm dying. So now
it's worse, right?
So now you got gap in treatment, and all those things are just, one, it's not good for your healing, but two, it's from the standpoint of a auto accident case, it's not good too, because those are things that all come back and kind of bite you in the butt as they try to put holes in your case, because you're just, you're trying to do the minimum and get through, versus maybe just doing what, see the treatment through and get healed completely before, being released.
Well, because it's just like you alluded to, the other side of this is that the insurance company's trying to pay out as little as possible.
Right.
They're trying to punch holes in your case that you're actually injured. And so it's critically important that people at least get evaluated.
And I'll see that too. When people first come in, the adjuster was so nice, they're really trying to help. And,
right.
And as the kind
they
of
were trying to smooth things over.
It's kind of, Dr. Jekyll and Mr. Hyde.
Yeah, exactly.
One thing I always suggest, with people, and it's not from a litigious, side, but sometimes it's easier just getting an attorney to help you along with the process. I mean, what happens if you get an attorney, they're going to kind of take your case over. They're going to deal with the attorneys. We as doctors cannot, if we see patients, we don't usually do it on a lien basis, because the insurance company won't pay us directly. So if you get an attorney involved, it kind of helps us as far as treatment, because then we have other physicians in our network that we can work with that will work on a lien basis once the attorney is in place.
A lien basis?
Yeah. So basically what happens is when an attorney gets on board, we sign a lien with the patient and with the attorney, stating that when the case settles, that our bill will be paid. So it's just a way.
I see what you're saying.
Yeah. So it's a way of the person getting treatment without any out-of-pocket expense up front. They'll be taken care of when the case settles. So they get the treatment they need. If they're not improving, we can refer out for MRIs. We can refer out for specialty doctors. Get that addressed, and then the attorney settles at the end of the case.
I mean, it seems like that might be risky for you, right? If you're doing all this treatment and then maybe the case doesn't get settled, or they don't get what they think they're going to get. I mean, maybe that doesn't happen very often. I don't know, but.
No, it doesn't. I mean, and that's why you're working with an
attorney.
You work with a reputable attorney too, because there's a lot of them out there. I mean, there's a lot of ambulance chasers. So, and you just need to make sure you have a good reputable attorney that's going to take care of you and take care of the case.
Well, that's good advice. I mean, I had no idea. I hope I'm never in a car accident, but
right.
I would literally probably do exactly what the typical person does. Oh, I'm fine. I don't need an attorney. Right. But all these things you just described, like, no, I should get evaluated right away. And then having an attorney and getting treatment on a lean basis would allow me to take care of these things without any out-of-pocket expense, right?
Right, exactly.
Maybe the financial stress of it is not there, which ultimately would allow me to get treated and get healthy.
No, exactly.
Yeah, interesting. Well, that's cool. That's really good advice. So you've been a chiropractor for 30 years. My next question usually has something to do with like innovation. Like, is there anything new going on like in the chiropractic field? Or is there any maybe technologies or new developments in like the techniques you use? Anything new, or is it kind of tried and true?
No, I think, there's things come out far as, as far as therapies that we do. Lasers is a new thing that's kind of come out. There is, we do what's called spinal decompression therapy, which is just a intermittent traction that we use that help with patients with disc herniations, and we've had good success with treating that and having, and getting them stationary and getting them out of pain. So, I mean, obviously there's a lot of things that we can do just to help improve that process of getting them well.
Got it. So tell me, what's the best part about your job? What's the best part about being a chiropractor?
I think just the people that I meet, and it's kind of interesting. I think some of my best patients have been the biggest skeptics, before they came in.
Right.
Because everybody, I mean, that's what's kind of tough about chiropractic. And I tell people this, I said, if you go to, and I've had people, well, I went to this chiropractor and he was terrible and I'm never going to go back. And I'm like,
right.
Well, if you went to a bad medical doctor or, if you went to a bad insurance agent, are you just going to stop and not do things? I mean,
right. Never get insurance again. Never see another doctor ever.
Right. So, I mean, you find somebody that works for you and that gives you what you need. And I think chiropractic is the same way. I mean, we have the ability to help you, but one bad experience may stop that from moving forward.
Why is that, do you think? Why are people why is it so easy for them to become skeptical of chiropractors? What do you think that is?
Well,
Any idea?
I think chiropractic's always kind of been the black sheep of the whole medical community. I mean,
yeah.
So I think that's part of it too. I mean, but
you guys went to medical school, right? I mean, you have a
I mean, you look at the amount of hours that we put in as a chiropractor versus say a medical student. I think upfront hours we probably have a little bit more. Where it really kind of changes as a MD finishes up his school hours, they start working in the hospital, working on their rounds as far as the different avenues of medicine,
right?
Where and pharmacology, where chiropractors we go into learning more physiotherapy and chiropractic adjustments, to in far as what we do to help our patients. So that's where it kind of changes a little bit. But I mean, book work, we're ahead of most medical doctors, on those initial phases of schooling. But I mean, it just changed. Like we go into more adjustive technique where MDs will go that other way. Same thing with like physical therapy. They're going to go directed towards more muscle rehab and that type of thing versus where we're doing more manipulative treatment for the spine and extremities.
So, the last question, I want to tie it back to our group, back to Bakersfield Business Partners. You've been a member of the group for how long? Do you remember?
I came in probably about the next year after they.
We don't know. Each week we don't know how long the group's been open, but it's 2010, 2008, 2009.
Yeah, still right about there. I know I was. They had their first membership drive, and I was in.
You were in that,
and I was in that
first group. Just tell me a little bit about what Bakersfield Business Partners means to you, how it's helped your business and helped you grow.
I think the biggest thing is in any business is it's the people that you touch. It's meeting people, and even when you treat people, having people have confidence in you that you do what you say and you say what you do. Mm-hmm. And I think with Bakersfield Business Partners, it's nice because we have a core group of people that if we need somebody in a specific industry, we know somebody in the group that we can trust that's going to take care of that patient or that person. And I think that's what B&I has been good. I mean, we get in there every week, we tell our story, and that's and the things that we do. And the more that each of us know each other more on a personal basis, more so than just a business basis, I think that definitely makes a difference on trying to sell yourself or sell other people in the group, when people need services.
Has the group helped you grow? Has it helped you get new clients, new business?
Oh, absolutely. Absolutely. Obviously, with what I do, there's some professions in the group that probably excel as far as referrals, a lot more than what I do. But I mean, it's just that constant weekly going in there, telling our story, and we pick up patients slowly, but it's a very inexpensive way of trying to market yourself and get your brand out there.
Well, obviously it's worked or it's done something right. You've been a member of the group for 12 years, so awesome. Look, we're glad to have you. Thanks again for joining us. I can tell you got a little bit of a dry throat today, and you kind of struggled a little bit, but we appreciate it, man. And I think for those listening, our group really is, it's 25 business owners and professionals, people like Jeff, who when you ask them what's the best part about their job, they're going to say it's helping others. It's helping people. That's ultimately, I think, what makes our group so exceptional is really we're all kind of have the same motivation. We're trying to serve others. And anyhow, I love that about our group. We meet weekly, Tuesday morning at 7:30. We have breakfast, and then we give a 60-second commercial on our business, on us. And people get to know us. They get to know, what makes Jeff different, what makes him unique, who's a good client for him. And so if you're listening, come join us. But Jeff, appreciate having you here.
Yeah, thank you.
And it's Friday, so have a good weekend. And until next time, this is Duncan, and we'll see you guys next week.